President, I'd like to ask now,
The Senate is in a quorum of calls.
I ask unanimous consent that the quorum call be lifted.
Without objection.
Are we now in a period where we go back and forth without limits?
We are.
Thank you, Mr. President. Mr. President, I ask that I be notified after 5 minutes, after which Senator Vitter, I think, is going to speak.
The chair will so notify.
Mr. President, we've talked a lot about what is in this bill, the massive tax increases, the massive cuts in Medicare. But there is another issue that I think, looking down the road, we are going to need to pursue, because we've talked about how groundbreaking this bill is. In fact, the majority calls it historic. It is historic. We believe it is historic in the bad precedents that it is setting, both in process and also in substance. And so I think that some of these precedents are going to be tested under the Constitution of the United States. And I just want to start talking about a couple of those. Number one, in the effort to get the last vote, clearly there were deals made. There were deals that affect individual states, and even one that affects 2 insurance companies that will have a different treatment from all the other insurance companies in America. It is said that there will be 2 Nebraska insurance companies that will not have to pay the tax increases of the insurance companies that will be levied on all of the other health insurance companies in our country. So I think that there is an issue that must be raised under the Constitution, the Equal Protection Clause of our Constitution, to take a set of companies in an industry, competitors, and of course we value the free market system and the free enterprise system in our country, and pluck out 2 competitors and say, you will be treated differently because we needed your vote to pass this bill, I think should be tested under the Constitution of the United States. And it is my hope that some insurance company that has standing to bring this suit will be able to test this precedent, because I think it is a very bad precedent, and it is certainly bad policy to start passing laws that distinguish some parts of an industry versus other parts of an industry that would be treated in a different way. So I hope that we will do that. Number 2, I believe there is a 10th Amendment issue. And here is my concern. Many states, including my state of Texas, have self-insurance plans for their state employees. States with large numbers of state employees find that self-insurance is a better way to go than private insurance programs. So in this bill, every insurance company that plans to increase its premiums must get approval from the Department of Health and Human Services first. Now, my state of Texas, with its self-insurance plan, then has to go to the Secretary of Health and Human Services to ask permission to increase the premiums on their state self-insured insurance plan. That is a violation of the 10th Amendment as I see it. I am very concerned that a state that has state employees that voluntarily sign on to be state employees, that accept a state-insured, self-insured plan, would then be able to be told by the federal government that you can't increase your premiums to cover the costs and keep the sound system that you have in place. Now, other states have self-insurance plans, so I believe they would also be very affected by this, and I believe that there will be a standing for a state with this type of plan to be able to challenge this part of this bill and hopefully bring it down if it is a violation of the 10th Amendment. Then I want to talk about another area that I think is a stretch in this bill, and that is that apparently the individual mandate is being justified by the Commerce Clause of our Constitution. Now, the Commerce Clause basically says that no state may impede interstate commerce. You may say, out in America, I don't see the connection. I'm going to be mandated to buy health insurance or be fined if I don't because states can't impede interstate commerce. Well, I would agree with people out there that that seems like a disconnect because apparently using the Commerce Clause, the majority is saying that the federal government has the right to manage insurance and that a requirement of an individual mandate is part of the federal capability to manage insurance in this country, and you can't impede that right by the federal government because you can't impede interstate commerce. Now, I think this whole individual mandate issue is going to be a center for discussion, debate, and opposition to the bill that is clearly moving down a track that we are trying to stop, but that train is moving. I think we're going to have to talk about the individual mandate. People are saying to me, how can the federal government tell me I have to buy insurance? And I think that they have a point. I mean, you have to buy automobile insurance because if you have a wreck, you have to be responsible. So you get the right, licensed by the state, to drive your car. And in exchange for that, a state may require that you have collision insurance on your automobile. And many states do. But when you say you have to buy an insurance policy, that I think crosses a line where a person has a right to say, I'm not going to buy insurance. Now, if you say, well, as long as you are not a burden to the federal government or to the state government or to any other taxpayer, that you should have that right. But that's not the way this bill is written. The bill is a federal mandate that every person in America has to have health insurance or be fined if they don't. So at least if we were going to write such a provision to keep the right of an individual not to have a mandate under the Commerce Clause of the Constitution, at least you ought to say that a person would have to sign something that says, I will give you a promissory note if I do not choose to buy insurance. But that's not the way this bill is written. So, Mr. President, I think this, along with the state mandate on Medicaid, which again, I think it's an equal protection issue, and maybe that's a stretch, but that one state will not have to ever pay the state share of the increase in Medicaid that is in this bill, but the other 49 states in America will, is certainly a violation of our responsibility to treat all states equally or to have formulas that have some ability to say there is a standard that has been set should prevail, but not in this bill. In this bill, my state of Texas will have almost a $10 billion increase in its state share of Medicaid because of the expansion in this bill. But there are states that are accepted from the increases and one state that is accepted forever because of a deal made to get that 60th vote to pass this bill. I think people are looking at this issue in America today and saying, what has gotten into the people in Congress that are voting for this bill?
The
So,
chair
Mr.
apologizes. I did not notify you at 5 minutes. I forgot. Your
Mr.
5 minutes has passed.
Mr. President, thank you for the notification, and I think there are issues now that will be raised going forward in the future, and there is still time for one senator in the 60 to change the vote, and therefore, Mr. President, I hope that one will hear from his or her constituents enough that that person will say it's time to slow this bill down. It is time to slow this bill down. I'm going to change my vote so that people can see all the effects that we haven't talked about yet. And let's do this right. We can lower the cost of health care. We can provide more access to more people to have health care coverage, which should be the goal of this legislation, this massive reform of a health care system that is working, that has provided the best quality of health care in the world. We have a chance to keep it by slowing this bill down. And that's why we're fighting. That's why we're still here talking 2 days before Christmas, 3 days before Christmas. We want to stop this bill and do it right. Doing it right is more important than doing it fast. And I think the American people believe that too. Thank you, Mr. President, and I yield the floor.
Mr. President.
The senator from Louisiana.